Hi, I'm Dr. Tiffany Jackson. I am a gynecologist and a specialist in minimally invasive gynecologic surgery at Garland OBGYN Associates. Today, I'd like to talk to you about a condition that many women suffer from, abnormal uterine bleeding. Many women experience abnormal uterine bleeding or heavy periods. Periods are not designed to make you miserable. Unfortunately, many women suffer from heavy periods, including soaking through their clothes when they have their period, having to use both a pad and a tampon at the same time, or having their period lasting more than a week. Unfortunately, none of these symptoms or situations should be normal. However, many women suffer from them. There are many different potential causes of heavy periods or abnormal bleeding. These can include fibroids, imbalances in your hormones, polyps, a condition called adenomyosis, where the tissue inside the uterus or the endometrium actually starts growing into the wall of the uterus. Heavy bleeding can also be caused by a condition called endometrial hyperplasia, where the tissue lining inside of the uterus grows too much and too quickly, or sometimes even rarely, cancer can be a cause. So if you have heavy periods, I recommend seeking treatment from a gynecologist. Your workup can include lab tests, checking your blood count, checking your hormone levels, an ultrasound of the pelvis, and perhaps even an endometrial biopsy or a sampling of the lining of the uterus. The treatment options for heavy bleeding really depends on the cause of your heavy bleeding. However, some of the most common treatment options include medications or hormones. Endometrial ablation is another technique, a procedure in which the lining of the uterus is burned so that women can have less bleeding or sometimes even no bleeding at all. And then finally, hysterectomy is the definitive treatment for heavy periods in which the uterus is removed. I am happy to provide women with all of the latest minimally invasive surgical techniques in treatment of heavy bleeding. Specifically, I offer women laparoscopic and robotic hysterectomy for those women who want definitive treatment of their heavy bleeding. With these techniques, women have less blood loss during surgery, experience less pain and less scarring, and have a quicker return to work and an overall quicker recovery. If you or someone that you know experiences heavy uterine bleeding, I would encourage them to seek treatment. Thank you.